Chapter 1, Introduction, The Pain We Can't See. Chronic pain is one of the most misunderstood health challenges of our modern age. Unlike an injury you can point to, a broken bone, a twisted ankle, or a cut finger, chronic pain doesn't always have a visible source. There's no obvious wound, no clear accident to explain it, and often, nothing remarkable shows up on scans or X-rays. Yet the pain persists. It lingers, weaving itself into the fabric of everyday life. Imagine waking up every morning already exhausted, not because you didn't sleep well, but because your body aches before your feet even hit the ground. Or picture sitting at your desk, trying to focus, while a burning sensation in your back refuses to quiet down. For some, it's sharp and stabbing. For others, it's dull and relentless, a constant background hum that never fades. This is the reality for millions of people across the globe. Statistics reveal that chronic pain affects more than 20% of adults worldwide, with conditions ranging from arthritis and fibromyalgia to migraines and neuropathy. It's not just a physical issue, it's deeply emotional and social. Persistent pain steals energy, disrupts sleep, reduces productivity, limits mobility, and often leads to depression, anxiety, and social isolation. When pain becomes chronic, life feels smaller, narrower, and more difficult. And here lies the frustrating truth: while doctors often prescribe painkillers, muscle relaxants, or anti-anxiety medications, these treatments rarely get to the root of the problem. They can dull the sensation temporarily, but they don't explain why the pain is happening in the first place. The hidden factor that ties so many of these conditions together? Inflammation. Inflammation is the body's natural defense system. It's meant to protect us and promote healing. But when it goes rogue, when it becomes chronic instead of temporary, it doesn't just accompany pain, it can become the pain. It's like a guard dog that never stops barking, even when there's no intruder. Understanding this hidden link between pain and inflammation is essential if we want to find real relief. In this series, we'll explore not only the biology of inflammation but also the lifestyle, diet, and environmental factors that make it worse, or better. We'll uncover practical, natural strategies to calm the body's fire, reduce chronic pain, and restore balance. This journey is about empowerment, knowing that your pain isn't all in your head, recognizing that your body is communicating with you, and learning that there are steps you can take to feel better, stronger, and more resilient. Chapter 2: What is inflammation? Friend and foe. To understand the hidden link between chronic pain and inflammation, we need to start with the basics. What exactly is inflammation? At its core, inflammation is the body's defense mechanism. It's how your immune system responds to threats, whether they come from outside, like bacteria, viruses, or injuries, or inside, like stress or toxins. Think of inflammation as your body's emergency response team. If you cut your finger while chopping vegetables, within seconds, immune cells rush to the site. Blood vessels expand, white blood cells flood in, and chemical messengers called cytokines orchestrate the healing process. The redness, swelling, and warmth you feel are all signs that your body is working hard to repair the damage. This is called acute inflammation, fast, effective, and usually short-lived. But here's where things get tricky. Sometimes, the body's emergency team doesn't leave after the job is done. Instead, the immune system stays on high alert, continuing to release chemicals that were only meant for short-term use. This is what we call chronic inflammation, and it's a very different story. Unlike the beneficial short burst of acute inflammation, chronic inflammation is like a fire that smolders quietly in the background. It doesn't burn your house down in a single blaze, but it slowly weakens the foundation, damaging structures bit by bit. Over time, this low-grade fire wears down tissues, joints, and even nerves. It doesn't just accompany pain, it creates it. Let's look at some of the main triggers of chronic inflammation. Poor diet, foods high in refined sugar, processed carbs, and industrial oils fuel inflammatory pathways. Imagine pouring gasoline on a fire every day, it just keeps burning. Sedentary lifestyle: when the body doesn't move enough, circulation slows, and inflammatory markers rise. Chronic stress, long-term stress elevates cortisol, which disrupts immune balance and keeps the inflammatory response active. Lack of sleep. Sleep is when your body repairs itself. Without it, inflammation builds. Environmental toxins, pollution, cigarette smoke, pesticides, and even household chemicals all irritate the immune system. Unresolved infections or injuries. When healing stalls, the immune system keeps fighting, even without an enemy. The result? Fatigue, stiffness, unexplained pain, digestive problems, brain fog, and increased risk of nearly every chronic disease, from heart disease to Alzheimer's. And here's the key insight: chronic inflammation doesn't just cause pain, it is the pain. When you feel persistent discomfort, it's often the body's way of telling you that inflammation is out of control. Chapter 3: Pain and Inflammation, the Biological Connection. Now that we understand what inflammation is, let's explore how it actually translates into pain. When inflammation lingers in the body, immune cells release a variety of chemicals designed to protect you. Among these are cytokines, tiny messengers that help coordinate the immune response. But when released in excess, cytokines irritate surrounding nerves and tissues. This irritation doesn't just stay local, it sends pain signals to the brain. Here's what happens step by step. Immune activation: inflammatory cells move into tissues. Cytokine release: pro-inflammatory cytokines like TNF, Illinois-6, and Illinois-1 beta are produced in large amounts. Nerve irritation: these chemicals directly irritate nerve endings. Pain signaling: the nervous system interprets the irritation as pain. Nerve sensitization: over time, pain receptors become more sensitive, meaning even mild stimuli can feel unbearable. This process explains why people with chronic inflammatory conditions, such as arthritis or autoimmune diseases, can feel pain flare-ups even without new injuries. Their nervous system has essentially been rewired to remain in a constant state of alarm. Other biological mechanisms also come into play. Cartilage breakdown: in osteoarthritis, inflammation erodes protective cartilage, so bones rub directly against each other, causing pain. Swelling and stiffness: inflamed tissues swell, making joints feel tight and difficult to move. Nerve damage: in chronic conditions like neuropathy, ongoing inflammation damages nerves themselves, creating burning or tingling pain. This is why traditional painkillers, like over-the-counter NSAIDs or prescription opioids, don't always work long-term. They may dull the perception of pain, but they don't address the inflammatory fire that keeps fueling the nervous system. The takeaway? To truly manage chronic pain, we need to calm inflammation at its source, not just silence the alarm bells. Chapter 4: The Role of the Immune System in Pain. The immune system is one of the body's greatest defenders. It's designed to detect threats, fight infections, repair injuries, and restore balance. Without it, even a simple cut or mild cold could become life-threatening. But like any powerful defense system, when it becomes dysregulated, it can turn its weapons against the body itself. This misfiring is at the very core of how chronic pain develops and persists. The double-edged sword of immunity. Normally, when bacteria invade or you sprain your ankle, immune cells flood the area to heal it. They release signaling molecules, like cytokines, that call in reinforcements, dilate blood vessels to increase circulation, and break down damaged tissue so it can be replaced with new, healthy cells. This process is often uncomfortable in the short term, think swelling, redness, or temporary soreness, but it's an essential part of healing. But when the immune system gets stuck in this mode, it stops being helpful. Instead of healing, it causes long-term damage. This happens in autoimmune diseases, where the immune system mistakenly identifies healthy tissue as an enemy. For example, rheumatoid arthritis, RA immune cells attack the lining of the joints, creating chronic swelling, stiffness, and pain. Lupus, the immune system attacks multiple organs, skin, kidneys, joints, and more, causing systemic pain and fatigue. Multiple sclerosis, MS immune cells damage the protective covering around nerves, myelin, disrupting signals between the brain and body and creating pain, numbness, and weakness. Even outside of autoimmune diseases, immune dysregulation plays a key role in persistent pain. Researchers have found that people with chronic back pain, migraines, and fibromyalgia often show imbalanced immune activity, too many pro-inflammatory immune cells, which stoke the fire of pain, and not enough anti-inflammatory ones, which put the fire out. Why lifestyle matters so much? Here's where it gets fascinating. Unlike your genes, which you can't change, immune balance is heavily influenced by daily lifestyle. The foods you eat, the stress you carry, the quality of your sleep, and even how often you move all directly affect immune behavior. Dietary triggers: eating too much sugar or processed food shifts the immune system into a pro-inflammatory state. Stress: chronic psychological stress raises cortisol and adrenaline, which throw off immune regulation. Sleep deprivation: even one night of poor sleep increases inflammatory cytokines in the bloodstream. Physical inactivity: a sedentary lifestyle reduces circulation and impairs immune system efficiency. This explains why two people with similar medical diagnoses can have completely different pain experiences. The one with a healthier lifestyle often experiences less severe pain because their immune system is calmer. The immune system, then, is both the problem and the solution. When it's overactive, it drives chronic pain. But when it's properly regulated, it not only prevents excessive inflammation but also actively promotes healing. Chapter 5: Chronic pain conditions linked to inflammation. Inflammation doesn't discriminate. It can affect joints, muscles, nerves, the digestive system, or even the brain. That's why so many seemingly different chronic pain conditions are, at their root, tied together by inflammation. Let's look deeper into some of the most common ones. 1. Arthritis. Osteoarthritis, OA, traditionally thought of as wear and tear, we now know that inflammation plays a major role. As cartilage breaks down, tiny fragments trigger the immune system, leading to swelling, stiffness, and worsening pain. Rheumatoid arthritis, RA. Unlike OA, RA is autoimmune. The immune system directly attacks joint linings, often starting in the hands and feet. Over time, inflammation not only causes pain but also joint deformity if uncontrolled. 2. Fibromyalgia. Once dismissed as purely psychological, fibromyalgia is now recognized as a complex condition involving both the nervous and immune systems. Recent studies show low-grade inflammation in the blood and spinal fluid of fibromyalgia patients, which may explain the widespread pain, fatigue, and heightened sensitivity they experience. 3. Migraines. Migraines are more than just headaches. Inflammatory molecules sensitize blood vessels and nerves in the brain, making them hyperreactive. This cascade can trigger the pulsating pain, nausea, and light sensitivity that migraine sufferers know all too well. 4. Chronic back pain. Back pain is one of the most common forms of chronic pain worldwide. While injuries like herniated discs or arthritis may start the problem, inflammation often keeps it going. Inflamed spinal tissues release cytokines that irritate nerves, creating lingering pain even after the original injury heals. 5. Neuropathy. Neuropathy, nerve pain, often stems from diabetes, infections, or injuries. But chronic inflammation worsens nerve damage, leading to burning, stabbing, or tingling sensations in the hands and feet. The immune system's attack on nerves themselves is often what makes neuropathy so persistent. 6. Digestive disorders, IBS, Crohn's disease, ulcerative colitis. The gut is one of the body's most inflammation-sensitive systems. When the intestinal lining becomes inflamed, pain, bloating, and cramping often follow. In Crohn's and ulcerative colitis, this inflammation is severe and chronic, spreading beyond the gut to affect overall health. The common thread. While each of these conditions looks different on the surface, they all share one hidden driver: chronic inflammation. This is why anti-inflammatory approaches, whether through diet, lifestyle, or targeted therapies, often help multiple conditions at once. It also explains why conventional painkillers, which only mask symptoms, often feel like temporary band-aids. Without addressing the inflammation, the pain always finds a way to return. Chapter 6: Diet, your first line of defense against inflammation. If there's one area of life that most directly influences inflammation, it's diet. Every single meal you eat either feeds the fire of inflammation or helps put it out. That's why researchers now consider diet not just a source of energy, but one of the most powerful forms of medicine, especially when it comes to managing pain. Anti-inflammatory foods that heal. Fatty fish, salmon, sardines, mackerel rich in omega-3 fatty acids, EPA and DHA, which block pro-inflammatory pathways and support joint health. Studies show regular consumption reduces arthritis pain and lowers cardiovascular risk. Olive oil, a staple of the Mediterranean diet, olive oil contains polyphenols that directly reduce inflammatory markers in the blood. Berries, cherries, and grapes. These fruits are high in anthocyanins and resveratrol, antioxidants that protect tissues from oxidative stress and reduce pain intensity in arthritis and gout. Leafy greens, spinach, kale, arugula packed with magnesium, vitamin K, and plant compounds that calm overactive immune cells. Turmeric and ginger, these spices contain curcumin and gingerol, natural anti-inflammatory compounds that have been compared to NSAIDs in effectiveness, without the side effects. Nuts and seeds, walnuts, flax seeds, chia provide healthy fats, plant-based omega-3s, and fiber, all of which improve immune balance. Inflammatory foods that worsen pain. Refined sugar and high fructose corn syrup spike blood sugar, triggering systemic inflammation. Processed meats and fried foods contain advanced glycation end products, ages, and harmful fats that inflame tissues. Refined grains, white bread, pastries lack fiber and spike blood sugar, worsening insulin resistance and inflammation. Excess alcohol damages the liver, disrupts gut balance, and amplifies inflammation. Trans fats, found in margarine, packaged snacks, and some baked goods, they are strongly linked to increased pain and inflammation. The evidence is clear. Dozens of clinical trials now show that shifting to an anti-inflammatory diet can reduce pain intensity in arthritis, fibromyalgia, and migraines within weeks. Patients often report better mobility, fewer flare-ups, and even improved mood, because inflammation doesn't just cause pain, it also contributes to depression and fatigue. Food as medicine. Think of food as a daily prescription. Unlike medication, which you take once or twice a day, food provides hundreds of opportunities to either fuel inflammation or fight it. Every bite is either a step toward healing or a step deeper into pain. By embracing a colorful, plant-rich, Mediterranean-style diet full of anti-inflammatory foods, you're not just eating, you're actively lowering the inflammatory fire that drives chronic pain. Chapter 7: Lifestyle Habits that Calm Inflammation and Pain. Diet is the foundation of health, but lifestyle is the glue that either holds healing together or lets it fall apart. You can eat the healthiest anti-inflammatory foods in the world, but if you're chronically stressed, sleeping only 4 hours a night, and sitting at a desk all day, inflammation will continue to thrive. Pain is not just physical, it's a reflection of how your entire life rhythm interacts with your biology. Exercise, movement as medicine. The human body was designed to move. Yet modern life often keeps us glued to chairs, couches, and car seats. Lack of movement stagnates circulation, weakens muscles, stiffens joints, and increases inflammation. Circulation boosts exercise improves blood flow, delivering oxygen and nutrients to tissues while flushing away inflammatory waste products. Reduced inflammatory markers, studies show regular exercise lowers CRP and Illinois-6, key markers of inflammation. Stronger support system, muscles act like shock absorbers for joints. Strong muscles mean less stress on bones and ligaments, reducing pain. Nervous system regulation, movement stimulates endorphins and serotonin, natural chemicals that reduce pain perception. Best types of exercise for chronic pain. Walking, gentle, accessible, and restorative. Walking after meals improves blood sugar and reduces systemic inflammation. Swimming, the buoyancy of water reduces joint stress while allowing a full-body workout. Yoga and Tai Chi combine flexibility, strength, and mindfulness, lowering both physical and emotional drivers of pain. Resistance training, even light weights improve muscle tone, stabilize joints, and enhance metabolic health. Electric light bulb tip: if you're living with pain, consistency matters more than intensity. 10 minutes daily beats one hard session once a week. Sleep, the body's built-in repair mechanism. Sleep is not rest time, it's the most active healing phase of your day. During deep sleep, the brain flushes toxins, tissues repair, and the immune system resets. Without quality rest, inflammation skyrockets. Sleep loss and inflammation: just one night of poor sleep increases CRP levels. Chronic sleep deprivation is linked to higher pain sensitivity and flare-ups. Pain sleep cycle: pain makes it harder to sleep, while poor sleep increases pain sensitivity, a vicious loop. Deep, restorative sleep: growth hormone released during deep sleep helps repair tissues and calm inflammation. Electric light bulb strategies for better sleep. Stick to a consistent bedtime. Limit screens 1 to 2 hours before bed. Keep your room cool, dark, and quiet. Try natural aids like magnesium or chamomile tea. Stress management: cooling the inner fire. Stress isn't just in your head, it's deeply physical. When cortisol and adrenaline stay elevated, immune balance is disrupted, fueling chronic inflammation. Meditation: just 10 minutes a day reduces inflammatory markers and lowers perceived pain. Breathing exercises: slow, deep breathing activates the parasympathetic nervous system, the body's natural calm switch. Nature exposure: studies show time in green spaces lowers cortisol, blood pressure, and systemic inflammation. Mind-body therapies: practices like mindfulness, qigong, or guided imagery reduce both emotional stress and physical pain. Hydration: the overlooked pain reliever. Even mild dehydration thickens the blood, increases joint stiffness, and amplifies pain signals. Water cushions joints, supports detoxification, and helps regulate body temperature. Electric light bulb: aim for 2 to 3 liters of water daily, adjusting for activity and climate. Infuse water with lemon, cucumber, or herbs for added anti-inflammatory benefits. Avoiding toxins, reducing invisible inflammation. Smoking: cigarette smoke directly damages blood vessels, accelerates arthritis, and sensitizes nerves. Air pollution: linked to systemic inflammation and worsen pain in arthritis and lung conditions. Household chemicals: fragrances, cleaning products, and plastics release chemicals that stress the immune system. Electric light bulb: choose natural cleaning products, ventilate your home, and reduce exposure to plastics whenever possible. In short, lifestyle habits act like a dial. Every healthy habit you adopt turns inflammation down, creating space for the body to heal. Every unhealthy one turns it up, adding fuel to the fire of pain. Chapter 8: Natural supplements for pain and inflammation. Food and lifestyle are the foundation, but sometimes the body needs an extra nudge. That's where natural supplements can help. While not magic pills, certain compounds have been studied for their ability to lower inflammation and ease pain. Omega-3 fish oil. Rich in EPA and DHA, omega-3s block inflammatory pathways that trigger pain. Studies show fish oil supplements reduce morning stiffness and joint tenderness in arthritis patients. Also support brain health and cardiovascular function. Electric light bulb dosage: 1,000 to 3,000 milligrams of combined EPA and DHA daily. Consult your doctor first. Turmeric, curcumin. Curcumin, the active compound, directly blocks NF-κB, a master switch for inflammation. Clinical trials show curcumin reduces arthritis pain as effectively as some NSAIDs, without side effects. Also improves mood and gut health, both linked to pain perception. Electric light bulb: best absorbed with black pepper, piperine, and fat, like olive oil. Boswellia serrata, frankincense. Used for centuries in Ayurvedic medicine. Inhibits 5-LOX, an enzyme that produces inflammatory molecules. Effective for joint pain, arthritis, and gut inflammation. Magnesium. Essential for nerve signaling, muscle relaxation, and over 300 biochemical reactions. Low magnesium is linked to migraines, cramps, and heightened pain sensitivity. Also promotes deeper sleep, indirectly reducing inflammation. Vitamin D. deficiency is strongly associated with chronic pain and autoimmune conditions. Supports immune regulation and reduces systemic inflammation. Especially critical in winter months when sunlight is scarce. Probiotics. Gut health equals immune health. Probiotics restore microbial balance, reducing inflammation from the inside out. Particularly helpful for digestive pain, but also systemic pain conditions like fibromyalgia. Important note, supplements work best as part of a holistic plan, not as a substitute for healthy eating and habits. Always check with a healthcare provider before starting new supplements, especially if you take medications. Chapter 9: Measuring and Tracking Inflammation in Chronic Pain. You can't manage what you don't measure. Understanding whether inflammation is driving your pain and how it changes over time is crucial for progress. Medical tests that reveal inflammation. CRP, C-reactive protein, detects systemic inflammation. High levels often indicate ongoing immune activity. ESR, erythrocyte sedimentation rate, measures how quickly red blood cells settle. Faster rates suggest inflammation. HbA1c reflects long-term blood sugar control. Elevated glucose fuels inflammatory processes. Vitamin D levels, low levels signal higher inflammation risk. Omega-3 index, a blood test that shows the balance of omega-3 versus omega-6 fats, crucial for immune regulation. Self-tracking, becoming your own detective. Beyond lab tests, your daily life offers valuable clues. Pain diaries, track when pain flares up, what you ate, your stress levels, and sleep quality. Patterns often emerge. Sleep logs, poor nights often align with worse pain the next day. Stress notes, emotional triggers often correlate with flare-ups. Activity trackers, wearables can reveal how movement impacts both mood and pain. The power of feedback. When you start tracking, something powerful happens. You begin to see the connections between choices and symptoms. Instead of feeling powerless, you gain control. You notice that when you eat processed food, your pain spikes. When you meditate, pain decreases. Knowledge is power, and patterns are the key to transformation. Chapter 10: Thriving Beyond Pain, a Holistic Path Forward. The connection between chronic pain and inflammation is no longer a mystery. It's a roadmap, a guide to reclaiming health, energy, and joy. By calming inflammation, you're not just easing pain, you're protecting your body against some of the most feared chronic diseases of aging: heart disease, diabetes, cancer, dementia. The core steps to healing. Prioritize anti-inflammatory nutrition, make every meal a healing opportunity. Think colorful fruits, greens, fatty fish, nuts, and spices. Move every day. Gentle, consistent exercise keeps inflammation down and mobility up. Protect your sleep. Treat sleep like medicine, because it is. Manage stress. Cultivate inner calm to protect your immune system. Use supplements wisely. Support, don't substitute, a healthy foundation. Track and adjust. Measure progress, celebrate wins, and refine your strategy. From surviving to thriving. Living with pain can feel like your body has turned against you. But understanding inflammation reveals a powerful truth. Your body isn't broken, it's signaling for help. And by responding with the right foods, habits, and mindset, you can turn down the fire, reduce pain, and reclaim vitality. Pain doesn't have to define your life after 50 or at any age. With patience, knowledge, and consistent care, you can rewrite your health story. The hidden link between chronic pain and inflammation is powerful, but so is your ability to fight it naturally. By working with your body, not against it, you can transform suffering into strength and live a vibrant, resilient life.